Autistic children are just aggressive? Let's talk about it. All right, fam, welcome back to the Franco and Friends YouTube channel. My name is Mark. On this channel, we talk all about autism. And in today's video, we're going to answer the question, are autistic children just aggressive? But before we do that, I want to remind you that I'm not a doctor or a medical professional. Nothing I say should be taken as medical or professional advice. All I'm doing is sharing our journey with you from the thousands of hours of research that I've done, as well as the strategies that we've implemented with my autistic son, where we were able to help him go from being completely nonverbal to speaking in full sentences and thriving in 6 short months. So if you want to learn exactly how we did that, you can click the link in the description and check out the Franco and Friends Autism Academy, risk-free for 7 days. Like I said before, it's not medical or professional advice, but I'm entirely open and honest about everything. All right, now let's dive in and let's answer the question, are autistic children just aggressive? My opinion is no, absolutely not. I don't agree with that. I don't think that is true. Now, maybe you're sitting on the other side of the screen and you're watching this video and you're thinking to yourself, well, that's great, Mark, but then why is my autistic child angry and aggressive? There can be several different reasons that an autistic child struggles with angry or aggressive behaviors. So let's unpack that and let's talk about some of the reasons an autistic child may struggle with these behaviors. The first thing that you want to look into is, does the child have a way to communicate? Because one of the biggest fallacies, one of the biggest misconceptions is that all nonverbal autistic children have nothing to say. This is not necessarily the case. While yes, every child is very different. So if you know one autistic child, you know one autistic child. But there are plenty of autistic children that are considered nonverbal that have tons of things to say. They just cannot verbally express it the way we can. I always tell parents to imagine this. Imagine if you had all these things. You had so many things that you wanted to say, but you had no way to say them. You couldn't communicate them. You had all these wants and needs, but again, you were unable to express them and you could never get your wants and needs met. So the first thing that you want to do is you want to make sure your autistic child has a way to communicate and express their wants and needs. You can do this a few different ways. You can look into a PECS system, which is the Picture Exchange Communication System, other visuals, or you can utilize a speech generating device. And the second most common reason that many autistic children struggle with aggressive behaviors is because they're in pain. They're in pain. Now, this could be from headaches, earaches, and probably the most common one for so many autistic children is constipation and gut health issues. Now, imagine this. Imagine you're in pain constantly, and on top of that, you're unable to communicate. The combination would likely cause anybody to be angry, uncomfortable, and possibly aggressive. I mean, just think about it. Being constantly in pain and not being able to get any help, that's a tough one. That's a tough situation to be in. Now, maybe you're wondering, okay, how would I know? How would I know what's bothering my child? Well, I want you to remember that behavior is a form of communication. Now, when you go to the doctor and you tell the doctor, my child is struggling with angry and aggressive behaviors, the doctor is going to come back and say, well, that's just part of autism. That is not the case. For so many of our children, that is literally the only way they can communicate. So you really want to watch your child. You want to observe their behaviors. Are they hitting their stomachs? Are they putting pressure on their stomachs? Are they posturing, banging their heads, smacking their ears, touching or rubbing their mouth? That's going to be a good place to stop. But what you really want to do is you want to work with an experienced functional medicine doctor who can do some testing on your child to see exactly what's going on. That's going to be the best course of action. You also want to look at your child's diet. You want to ensure that they're not consuming foods that they're allergic to, intolerant to, or sensitive to, because what that's going to do is it's going to cause inflammation, leading to gut health issues, stomach aches, as well as numerous other health issues. Now, I know what you're thinking. I get it. I know changing our kids' diets is very challenging and is super stressful. So I wouldn't recommend doing a complete overhaul, going gluten-free, casein-free, and dairy-free right off the bat. The first things that I would look at is removing food dyes and artificial sweeteners, because those have been linked to hyperactivity, amongst other health issues. And you also want to remove MSG, which is monosodium glutamate. It's a flavor enhancer, because what that does, it increases levels of glutamate in the brain, which is the main excitatory neurotransmitter in the brain. And what can happen is your child can have an imbalance between the GABA, which is the main inhibitory neurotransmitter in the brain, and the glutamate, like we said, which is the main excitatory neurotransmitter in the brain. And this can cause hyperactivity, aggressive behaviors. And on top of that, this can also lead to something called excitotoxicity. And this is when there is an excess amount of glutamate and the receptors are so overexcited, they're so overstimulated that this can literally lead to cell death. In another video, we'll dive much deeper into the neurotransmitters and the importance of having a healthy balance between the GABA and the glutamate system. Now, another thing that you want to look into is you want to ensure that your child doesn't have any vitamin or mineral deficiencies. So you may want to ask your doctor to test your child's lithium, potassium, folate, and magnesium levels, among other things, to see if your child is deficient in anything else. Your child being deficient in any of those can lead to aggressive behaviors. Now, if you want to learn more about lithium orotate, supplemental lithium orotate, not to be confused with prescription lithium carbonate, you can check out the video I did on supplemental lithium orotate, where I talk about how it may be beneficial for your autistic child, and it has been life-changing for my son. So again, if you want to learn more about that, check out the video that I did on supplemental lithium orotate. And the last two things that I want to mention are EMFs and mold. Overexposure to EMFs have been linked to aggressive behaviors. This would be from excessive screen time or Wi-Fi. So what you want to do is you want to try to reduce your child's exposure to EMFs by cutting back on screen time. You can turn airplane mode on any device. And during the nighttime, you also want to try turning off the routers. And then lastly, we have mold. Exposure to mold has been linked to aggressive behaviors, among other issues. Now, this one is a difficult one because some people are more sensitive to mold than others, and it can be hard to locate because it can hide in vents, it can hide in walls, it can hide in the floor, as well as ceilings. So again, testing is realistically the best way to identify if your child's suffering from mold exposure. All right, fam, I appreciate you watching today's video on some of the reasons why an autistic child may struggle with aggressive behaviors. Before I let you go, I want to remind you that every child is so different, and there are several different reasons that an autistic child may struggle with aggressive behaviors. So again, if you want to learn more about that, check out the Frankel and Friends Autism Academy. You can experience it risk-free for 7 days. Again, it's not medical or professional advice, but I'm entirely open and honest about everything, and I can walk you through the exact step-by-step process that we used to reclaim my son's health and help him to thrive. And if you found this video helpful, you can like this video and you can also subscribe to the channel to see more videos just like this. I appreciate you, and I'll see you in the next video. Take care.